Good evening, doctor. Good evening, please sit down. I've got a stomachache, doctor. I see. What do you feel? I have got sharp pain and heartburn. How long have you had this pain and acidity? For 2 days now, it does not go away. I eat, and after every meal, my stomach hurts. At night, the pain seems to double. Is the pain continuous or does it come and go occasionally? It comes and goes. It hurts me the most after every meal. Other time, the pain isn't that severe. Is there any kind of food that affects you? Greasy ones and food which has got coconut milk in it. Okay. And where in the abdomen does it hurt? Please point it out. Does the pain travel to your chest or shoulder? It hurts in the middle. Sometimes the pain travels across my abdomen. You said you have heartburn besides the pain too, right? Yes, doctor. After a burp, I feel kind of sour taste. Have you noticed any change in the consistency of your bowels movement? By any chance, have you noticed blood or a color change? It is a bit softer and slightly greenish. I do not see any blood in my bowel movement. All right, I will examine your faces to check if there is any kind of parasite. I would also like to examine your upper gastrointestinal system through x-rays and contrast. It's effortless. You'll have to drink a thick substance and the radiologist will see how you digest a substance. They will see the movement of your stomach. I have let the staff know about your x-ray. Please follow him. Do you have any questions before that? With so many medical tests, I was wondering if I have an ulcer. We need to think of that too. That is why I want the test. An x-ray of the upper intestine sometimes cannot detect an ulcer or other irritation. If the pain persists after some antibiotics, you will need an endoscopy. Any other questions? No, doctor. Thank you very much. Good. Get your x-ray done immediately since we have a vacancy now. And visit me as soon as you get your reports. Goodbye. Goodbye, doctor. I'll see you soon. Hello, welcome back. I did not think I would need to see you again. Yes, doctor. Me neither. Tell me how you're feeling after the surgery. I feel terrible. My entire body is aching and I can't stop shivering. My vision is blurry. My mouth is dry and I feel fragile and dizzy when I get out of the bed. That is to be expected after a severe operation. I know, but I get so warm that I feel like I'm burning up, and recently my body feels itchy. You have a fever or maybe an infection. Describe exactly where you are aching the most. I think my back and legs hurt the most. They're throbbing and I think they're also swollen. Okay, I'm going to check your temperature and your pulse. You may need an antibiotic if you have an infection. Can you give me something for the pain? My whole body is sore and my head is aching too. Your temperature seems fine, so you don't have any fever. I will prescribe you some painkillers for now, but I think this is just a post-surgery pain. Thank you. I hope the pain goes away fast. Hello, what seems to be the problem? I have a chest pain. How did the pain begin? What were you doing? I was resting and suddenly felt a stinging sensation around my chest region. Did you work out before? Almost half of the ischemic conditions occur after physical activity, emotional stress, or after consumption of alcoholic beverages. No, doctor, I did not work out or consume any alcoholic beverage. Have you previously ever had the same sort of pain? No, I have not. Can you please describe the pain and how long it has been bothering you? My chest feels constricted as if I'm drowning. It has been approximately 30 minutes since I felt the pain. Sometimes it is a stabbing pain, other times it subsides and begins anew. Tell me exactly where it hurts. It's on my sternum. Then it expands on both sides of my chest, almost on the left side. Have you used any medication? Nitroglycerin, but I don't think it had any effect. Do you have any other problems? You appear very pale to me right now. I have a hard time catching my breath sometimes. Feels like I'm choking. I will prescribe you some medicines for temporary relief, but I recommend you get an ECG done and visit me immediately.